You may have heard of these names in the news lately, certainly seen the commercials: Ozempic, Wegovy, Mounjaro, Semaglutide. Well, many people are now turning to these medications, originally made for type 2 diabetes, to lose weight. Forget about portion controls or willpower. They're now going to this to shed some pounds. And now this new method has entered the market, and there's been a hot debate, even among health experts, as to whether it's safe or is it something healthy. Hi everybody, I'm Candace Gibson, your host for today's discussion, and coming to you from the Baptist Health Newsroom. So these medications are now being prescribed off-label for weight loss use. And here to speak with us more about these medications are two experts from Baptist Health: endocrinologist Dr. Angel Alejandro and Elena Rosario, who's a pharmacist at Baptist Health. We thank you both for being here. This is an important discussion. This has been coming on in the news in the last couple of years, so really happy that you guys are here to speak with us about it. Before we get started and dive into today's discussion, wanted to remind you, those watching, to send in your questions and comments. We're here for you and happy to answer any questions that you may have. So originally, Doctor, this was developed to treat type 2 diabetes. Talk to us about that and how the off-label use of this came about.
Right, so these drugs it's an exciting new class of medications for the treatment of type 2 diabetes. What they found during the research, during the trials, were that these patients had substantial weight loss when they took these drugs. And obviously that is something for an endocrinologist that's extremely exciting, to have a drug that targets one of the problems with diabetes, which is obesity, right? And we know that obesity increases insulin resistance, and we know that if you can lose just 10% of weight, that'll have a significant impact on your glycemic control. But the fact that these patients were found to be losing 15% of their body weight was something that was unexpected, but much appreciated. 15% within what period of time are we talking about? Well, these studies are 1 to 2 years, right? You're not going to lose 15% of your weight in a month. That sounds unrealistic. Yeah. But you have a progressive weight loss seen with these agents, and that weight loss obviously helps not just with the diabetes, but with other cardiometabolic risk factors. Yeah, you know, Elena, way back when, we used to have this movie, Devil Wears Prada, and there's a joke in it where she's like, I get hungry and I eat a cubic cheese and then I forget about it. And it kind of brings this back to mind. Is it true that people don't even think about food?
Yeah, so these medications are very fascinating because there's different ways that they work. So they are part of a class called GLP-1 receptor agonists, and in our body we produce a natural hormone called GLP-1. So these medications give us a little bit more of this hormone. So it helps with digestion, slowing the digestion down, helps with blood sugar control, as well as appetite suppression.
Yeah. Go ahead.
No, I was going to say, in our body we have these receptors in our brain, in our pancreas, and in our stomach. So this is kind of the ways that these medications work.
Yeah, and what happens when you stop using them?
So if you're using it to treat type 2 diabetes, you can see that their blood sugars will probably go up. If we're using it for both type 2 diabetes weight loss or just for weight loss alone, you might see your appetite come back when you stop the medication.
Like with a vengeance, or?
Sometimes. And I even have patients that will go from a higher dose to a lower dose if there's a back order on the medication. That could potentially see an increase in their appetite a little bit as well.
Interesting. Well, doctor, as you know, these weight loss drugs have been touted by many as a tool for those who are struggling with their weight, but we probably need to talk about the underlying factors of obesity, including diet, of course, activity levels. Should those on these medications be making healthy food choices and doing a little bit more exercise while taking these medications?
You're absolutely correct. If you actually look at the data, the trials, these patients received this drug in addition to diet and exercise. Right? Okay. This drug did not replace diet and exercise, and that's very, very important. If you exercise while on this drug, you will lose more weight, right? It's all about plus gains, and it's a balance, right? If you burn more calories, you lose weight. If you consume less calories, you lose weight. This drug will help you consume less calories, but if you do your part and you burn some more calories, you will have a more significant response in terms of weight loss.
Yeah, is it fairly unusual that you have these drugs that are meant for one thing and then boom, becomes something else? I believe Viagra, for instance, was to treat heart pressure.
Right.
And now you have this.
Well, in the diabetes world, yes, this is extremely exciting because we have all these agents now that are helping with weight loss, but at the same time are cardioprotective, reducing your risk of heart attack, reducing your risk of stroke, reducing your risk of ending up on dialysis. And these are being given to patients with and without diabetes. So that's neat. That's what's exciting. You have a diabetes drug helping patients who are not diabetic.
Yeah, fascinating. But it is still fairly early, I'd say, in the use of it as off-label for weight loss. It's fairly evolving, and these medications also have some serious side effects, don't they, Elena? What are they?
Yeah, so the most common side effects of these medications is nausea, a lot of stomach-related side effects, nausea, vomiting, diarrhea, constipation, some heartburn, especially with tirzepatide or Mounjaro or the new Zepbound, hair loss. I've noticed some patients complain about it as well.
And it's all in injection. I know you have a few of them with you right now, but and which ones are these?
So this is Wegovy. So this is Semaglutide for weight loss.
Okay.
Different pen. Ozempic is also Semaglutide, but this is for type 2 diabetes.
Okay.
And this is Mounjaro, which is for type 2 diabetes.
And they're all just injections to the stomach?
Yeah, so you can do it in the stomach area, the top of your thigh, or the back of your arm.
Okay, interesting. And what's a consequence, you'd say, doctor, of the popularity of using these medications off-label? We talked about the side effects, but people living with diabetes did not have access. I was told by a doctor just a few weeks ago they can't prescribe Wegovy anymore because they can't have access to it. Is that a side effect in essence?
Well,
the popularity of it?
Obviously, supply and demand always plays a role in anything in this world. But what's important is that we're talking about off-label, but now we have two drugs that are on-label, right? You can use Wegovy, which is semaglutide, which is approved for weight loss. If your BMI is greater than 30, you can use Wegovy. If your BMI is greater than 27 and you have a risk factor, you can use Wegovy. Now, what was happening is a lot of insurance companies may not cover the Wegovy, and then patients were turning to the off-label use of Ozempic, which is the same exact drug. And that's where we ran into trouble, where we don't have enough drug to go around, and patients with type 2 diabetes who need the drug may not have been able to get it for a period of time.
Does it also have an impact, like whether you consume different things? Like say if you consume alcohol with some of these drugs in excess, what impact does it have? Do you know?
So I always counsel my patients, there's not an absolute contraindication with alcohol use in these medications. However, the way that they work, they're slowing your digestion, so they are staying full for longer periods of time, so the alcohol may stay in your system a little bit longer, so they might feel the effects of like a hangover a little bit more. So it's not as ideal for our patients to be drinking alcohol on these medications.
And you can eat whatever, but you also have to remember to eat, I believe, right?
Yeah, so at least when I counsel my patients, the biggest side effect again is nausea. So to minimize that side effect, I always tell patients they have to eat at least every 3 to 5 hours. And because this medication is suppressing your appetite, you might forget to eat. So you have to be very conscious in the fact that you need to eat something, because if you go too long without eating, then the nausea will get worse.
How do you decide whether or not, doctor, that you're going to prescribe this medication to somebody? Because everybody has, will look at their body and say different things. So if a patient says, I have a killer dress or suit that I need to get into in 6 weeks.
Well, you have to look at who walks in the door, right?
Yeah.
So if you have a diabetic patient who's obese, you want to give them a drug that addresses obesity, not just their sugar. If you have a non-diabetic person who's obese and has risk factors for cardiovascular disease, then you may consider, listen, why don't I give you a drug such as Wegovy, which is semaglutide, to help you lose weight? And let's say you have a patient who comes in who looks like a pre-diabetic, who is a pre-diabetic, who if you do nothing will develop diabetes, then that may be a nice opportunity to try to prevent diabetes by giving them a drug that will promote weight loss.
And Elena, just recently the FDA approved a new version of these medications, of these weight loss drugs. Do you foresee more medications like this getting approval for weight loss?
There's a lot of ones coming out in the pipeline. Oral version of these medications, more injectable versions, multiple mechanism of action. So yeah, for sure in the next couple of years, I think we're going to see a lot more.
I kind of get a sense that we're at a pivotal point right now when it comes to weight loss and weight loss medications. When before in history can you recall that we've had these sort of things that have had such an impact and where there's just been a flood on the market with this? Do you recall?
Well, if you think about gastric surgery for weight loss, you have about a 20 to 30% reduction in weight. The earlier drugs that we had for weight loss gave you about 5, 8, maybe 10% if you were lucky. Now with semaglutide, you're getting 15%.
15%.
With tirzepatide, I always say it
like
wrong,
20, yeah.
it's 20%. And some of these newer agents, it's even higher. Yeah. So you're getting to the level where this could be comparable at some point with gastric surgery, which is irreversible and has its own consequences.
Yeah.
You know?
Do you consider a healthy part of a person's lifestyle? Do you recommend it to patients routinely as saying, this will help your lifestyle?
I do. I do. And I think by having something that will suppress appetite, it makes it easier to diet, right? Pick whatever diet you want. You can do keto, South Beach, intermittent fasting. Yeah. If you're on a drug that'll keep you less hungry, more likely you'll be able to succeed and keep on that diet. And remember, it's all about calories. You take in less calories, you lose weight. You burn more calories, you lose weight.
But then if you come off of it, are there any like tricks or tips to keep the weight off?
So these medications, at least Wegovy and Zepbound now, are indicated for chronic weight loss management. So that's how they're marketed. That's what they're indicated for. So I get this question from patients all the time. Can I stop the medication? How long am I going to have to be on this medication for? So everyone's a little bit different in the way that I counsel. So some people may need to be on it for longer periods of time, especially if they're using it for type 2 diabetes to control their blood sugar. Some of them, if they're just using it for weight loss, we can have that conversation of, are you implementing all of the healthy lifestyle habits that I counsel on as well, according, with the medication management. So nutrition, exercise, working with a registered dietitian, nutritionist is going to be really key in with these patients. So if they can keep these habits in the background, maybe they can stop and then not regain the weight that they lost back.
There's some people that max out though, right? After a while?
So max out on the amount of weight that they lose?
Max out on the amount they can inject themselves with and weight.
So these medications are dosed every 4 weeks and increasing the dose every 4 weeks depending on tolerability of the medication, how well the patient can tolerate that med. So there is max doses for these meds and there are maintenance doses for these meds too. So we can keep a patient on a dose and maintain that weight loss that they have already achieved.
All right. Well, we were looking at some of the more popular questions that people ask when it comes to many of these weight loss drugs. And this one was interesting because I never thought about this. Can children and teenagers take these weight management medications, doctor?
Semaglutide has been approved for adolescents over the age of 12 who have a BMI greater than 30. So yes, semaglutide, yes. For the newer one, the trial is still ongoing. But yes, we have young children who suffer from obesity, and it has been approved in that population, yes.
Is there one that's out there that we, as laymen, might not be aware of that you think, wow, this might be a game changer, this might be really big, that's coming down the pipeline?
So there is an oral medication out there, and I'm not even going to try to pronounce the name for it. But I think that might be really a good option for people who don't want to inject themselves too, an oral formulation of the med. And it looks like it was showing very similar weight loss reduction as the ones that you can inject too. So I think it's going to be good.
That's interesting. What are the risks of taking these Ozempic-like medications with other medications? One of the more popular Googled questions about this.
Well, we use it in combination with other drugs for diabetes, right? Because there's a very low risk of hypoglycemia with these agents. So I'm not too concerned about interactions with other drugs. Obviously, hypoglycemia may be an issue, but we would see that with patients who are on insulin or sulfonylurea. But for the most part, they're relatively safe. If you can get through the GI side effects, I think you're going to do all right.
I think the only thing that I would add to that is definitely for tirzepatide or Mounjaro or now Zepbound. The biggest thing, especially for young women who are using it solely for weight loss or maybe for type 2 diabetes, is the birth control. Because it slows the gastric emptying, slows digestion and absorption of medications. It can be a little bit less effective with their hormonal oral contraception. So I always have that conversation with patients that they should be using another method of contraception in the 4 weeks that they start it or if they increase a dose.
Yeah, and should you be getting pregnant while on these things?
No. So if you're thinking,
No. This drug is not improved in pregnancy, period. So if you become pregnant on this drug, you have to stop it immediately.
Okay.
Yeah. And I also recommend if they're planning on getting pregnant, probably not to be on it for at least 2 to 3 months as they're actively trying to be pregnant as well.
And obviously during the course of a pregnancy, definitely do not.
Correct.
Okay. Interesting. Well, this has been a great discussion. Really appreciate it.
Well, thank you.
And especially as so many people are seeing the commercials and thinking, oh yes, this is the key to my weight loss. Why not do this? So, Doctor, thank you. Elena,
thank
thank
you.
you as
Thank
well.
you.
And remember, to our viewers, be sure to hit that subscribe button on our channel here to keep up with the very latest health and wellness information and tips from our experts. And you can also connect with us on our social media channels: Facebook, Instagram, Twitter, TikTok. We're on TikTok and LinkedIn. And check out our resource blog for the latest news at baptisthealth.net/news. You'll find a link there to all episodes as well of the Baptist Health Talk podcast. On behalf of everyone at Baptist Health, stay safe and stay healthy. Thank you for watching.